Hi, it's Jennifer from Pilates Back and Joint Exercise again. Today I'm going to talk a little bit about how to align the pelvis so you can get rid of SI joint pain. It can help with sciatic pain and just really align your body. You really don't want to strengthen or do any kind of Pilates or strengthening exercises unless the pelvis is aligned. So I'll take you through a series of 3 exercises to begin with to align the pelvis, and then we'll do some strengthening, kind of progressively getting harder towards the end of the workout. So if you have a ball or a pillow, a strap, or you can use a stretch band or something around the knees, and then a dowel or some kind of pole or post to use for this first series, that would be helpful. So we're going to lie on our back and just start, and let's imagine that maybe I have some pain in the left SI joint area, and my hip is anterior tilted on that side, so it's a little bit forward there, and it's posterior tilted then on the right. So what I want to do is I want to release this anterior tilt down. So I'm going to work the glute on that side. So I'm going to put the dowel behind the hip that's, you could say, tilted up or in an anterior tilt. And then the posterior tilted side, I'm going to work more in the hip flexor on that side. So then that means the dowel is in front of it. So what I'm going to do, I'm just going to hold the dowel still, and you'll see, you won't actually see any physical, maybe a little bit, but not a lot of physical movement between the knees or the hips, and the dowel stays pretty straight as well. So I'm going to push and pull. So I'm pushing against the dowel here, pulling into it on the other side to help release that hip down. So I'll exhale for about 4 or 5 counts. And then I'll inhale, relax, and again I'll exhale. So I feel this stretching in the pelvis without any actual movement. So isometric exercise, there's no movement, but there's effort. And release, and again, exhale. Now, if there isn't a lot of tilt or change, you can do that on both sides. And again, I'll push on the right side into the dowel, and I'll pull into it on the left side now. So it's going to be an equal push-pull. And this can just keep your pelvis balanced if it already is in good shape. So again, push-pull, exhale, and I feel some tension, I feel some work in the pelvis doing this, some pulling diagonally, diagonal action. And go through that about 3 or 4 times on each side, or just the side that you need to work on. So once you've done that, I'll just set the dowel down. You can go through a little hamstring stretch as well. So I'm going to push the heel up, and again I'm pressing the back of the leg into the hand with no actual movement really happening there. Keeping the head, neck, and shoulders relaxed. And my pelvis is in neutral, so I still have some space here in the lumbar spine. Then I'm going to grab my strap or rope and just wrap it around. This is just a yoga strap. And I'm going to get it fairly tight. If you have a Pilates ring, you can also wrap that. And I'm going to press out into it. So I'm working my abductors and press out. And I'll do that about 5 or 6 times as well. So again, I feel this pulling or stretching in the pelvis with no movement. This works the lateral hip and thigh muscles. And then when I'm finished doing those, take that to the side, and then I'll take a ball and work the adductors. So now I'm going to squeeze the ball between the knees here. So try to bring your heels right under your knees. Take a breath in, and again, as you exhale, squeeze or tension the ball. And then here you feel your medial, vastus medialis, your inner thighs, and release. And again, exhale, tension, and release. So I feel this tightening between the hip bones, kind of a narrowing there, but no actual change in my pelvis, so no movement there. And good. And then you can just notice I feel like I'm level now. You may or may not feel that way, or can see if you're visualizing, if you're watching somebody. So now we should be pretty well aligned. So we can work, and we'll progressively again work harder into exercises that can help stabilize and strengthen the pelvis in its hopefully neutral or natural alignment. So we'll just go through some bridges, pressing up, and I'm going to come kind of weighted into my shoulders, into my kind of upper rib cage. And so as you're here, you can do a couple of things. You can tilt the pelvis, and just notice if you're tighter or looser on one side. So I'm dipping the left hip, raising the right hip up. The knees are staying level. In fact, you could keep the ball between your knees here if you wanted to keep your alignment better. And that's working okay. So I'm going to peel down. I don't notice any tightness or tension in my SI on either side. And so then I'm going to try a little one leg. Again, I want to try to keep the hips lifted and level, pressing. You might notice a little weakness or sagging on one side compared to the other, so you can work that side a little more. I feel pretty level here. You can add some extensions to this. Shouldn't feel any pain. If you are feeling pain or you don't feel quite level, then I would say not to progress yet. Okay, from there, we can do a little side leg drop. Again, keeping the pelvis level. Allow one leg to go to the side. Now, if I forced it and this hip came off, I'm not really doing much to align or strengthen the pelvis. So from there, I'll pull it back in. Inhale. And just notice whether you have tightness or tension. Try to release the muscles around the hip as it drops to the side. So as I'm going to the right, another thing to focus on, try to keep your left rib cage down into the mat. You'll notice that'll want to pull off as well. And as I go to the left, I'm going to try to soften my right rib cage down. And it's a little harder on this to keep this left side down, so I'm going to work a little harder there, a little tighter on that side. And from there, we'll go into a tabletop position. Now you can do that same exercise here. We have a little bit more weight to work with, so it takes a little more core support, a little more core effort to keep that opposite rib down. You could even do this in a straight leg position, out to the side, and again, out to the side. Trying to stay relaxed in the head, neck, and shoulders. Okay, so from there, I'm going to work my core strength a little bit more to support the pelvis in this now neutral alignment. So I'm just going to dip my toes in the water. And as I do that, again, I'm going to focus on the rib on the opposite side. So there's this diagonal abdominal support happening. Dip and fold, and really pull down into the table as with the rib cage as you dip that foot down. And then you can try stretching a little farther away. So the farther you get from the core of the body, the more work it takes to keep the ribs down. You can add opposite arm and leg, so I'm really pulling down. Now on the right side, as I stretch that right leg, taking the arm overhead helps keep the rib cage anchored a little more on that side. And call this the dead bug or opposite arm and leg extension. Okay. And so for the next exercise, we'll turn on our side and we'll do some side work. So it's important that the hips and shoulders are aligned. I'm just going to let my head rest on my arm here. Hips are stacked, shoulders are stacked, so there's a little space between my waist here. And then the knees are lined up evenly. And so I'm just going to start with the sideline clam. So I'll squeeze the heels, and open the top knee, and close, and open. And from there, you can try raising so the knee and the ankle lift at the same level here. And again, we're working these abductors. So again, these are all strengthening exercises for the hips, the pelvis. And from there, keeping the hip level with the floor, hips lined, shoulders, chest not thrown forward. You can do a little forward and back movement. So carefully back, we're going into hip extension there. So you'll come to a point where you're zipping, you're pulling up and in with the abdominals to support that leg behind you. And those feel good and aligned. And then the same thing on the other side. So coming over again, supporting the head, lining the hips and the shoulders up. Good neck alignment. So I'll bring my bottom back. And then making sure again the knees are lined. And then starting with a clam. So keeping the heels together and opening. And you want to try to look straight out. I know it's kind of natural to want to watch what's going on, but try to keep good neck alignment as well. And then I'll raise the knee and the ankle so it comes just parallel to the floor. And again, you're kind of feeling that. It's going to help strengthen the SI joint area as well if you're weak in that area. And then from hip level, swinging and pulling up, and exhale. Again, keeping this shoulder alignment above so I'm not throwing myself forward to get a farther reach with that leg. And back and front. And once more, exhaling as you reach. Okay, and so next we'll go into some prone or stomach, belly down exercises, and then we'll do some kneeling, and then we'll finish with a plank. And so again, these are progressively getting more difficult. So from a prone position, you can just lie with your pelvis stable. So the goal is the pelvic triangle, the pubic bone, and the two hip bones stay level with the floor. So I want to hollow or draw the abs up and in, and try to do that without squeezing your bottom. So stay relaxed in the back, and you can maybe imagine narrowing your hip bones in the front. So working from the front to extend the leg, to lengthen it. And only as high as you can keep the hip bone on the same side down and the hips level. And so I'm just alternating legs and lengthening, trying to reach away instead of going for a lot of height with that one. And then the cobra is a helpful exercise. So again, these are going to be helpful for sciatic pain as well. Extension, inhale. So again, I'm going to try to keep my bottom relaxed. I'll tuck my elbows in and widen the chest and let the ribs reach forward a little as I come up. So I feel like I'm squeezing my bottom a little, so I'm going to release it and try to narrow the hip bones again in front. And then as you come down, lengthening forward. And again, inhale. Exhale. Again, try to release your bottom. Keep the elbows in. Chest wide. The ribs in the sternum reaching forward. And then breathe in and out to come back down forward. So next we'll come up to a kneeling position. So hands under the shoulders, fingers spread wide, knees under the hips, and then keep the eyeball, the inside of the elbows facing each other. So we're not locking there. And so in this position, I just want to keep again the pelvis neutral. So I'm just going to kind of push into the table a little bit here. Keep my neck long. Again, shoulders wide. Maybe imagine squeezing a gem in your belly button to keep a little activation there. And with an inhale, I'll extend the right leg. Now, I want to keep the hips square with the mat. So I'm going to feel this internal spiral up, of my right thigh to the ceiling. If it was turned out, it would look like this. So I'm going to feel an internal lift and then pull it under. So again, it's important that hips are parallel with the floor. And again, lengthening the leg just parallel to the floor. If you're stable, you can try the opposite arm extending here. And again, feeling that internal spiral up and away. And you softly come in. So you want to try and keep your torso as quiet as possible as you switch, lengthening arms and legs. So from there, I'm going to press up into a plank. So I'll take my right foot back and then my left. Hips are square. Again, you can do little tricks with the feet, pulling up, pointed toes, pushing the heels away. You can try one leg here as well. So again, if you're having trouble doing this from a kneeling position, do not come to a plank yet. And you can try that on one foot, point flex, and the other point flex. Keep narrowing the hips in the front to keep that support. And then just finish in a shell or a child's pose. And thanks for joining me today.